I know that you are doing very good work. It's very important, and you're doing it well. Thank you. You're somewhere between the space of excellence and perfection. Listen, Sort, Empower is a way to engage the whole team closest to the patient in moving farther from excellence and closer to perfection. And it does it by fully engaging the people who understand the processes and what gets between them and the best possible patient care every day. Edwards Deming taught us that bad process hurts good people every day. And every healthcare organization in America has an opportunity to improve their processes and systems of care and to stop hurting ourselves and to stop hurting patients. And so Listen, Sort, Empower is a way to identify opportunities to improve process so the people that care for patients, families, and communities are set up to succeed in the best way possible. A mentor here, a friend of mine, is Maureen Bisignano. She's the past president of the Institute for Healthcare Improvement. She taught me that you cannot give what you do not have. And when we look at healthcare professionals today, 40 to 50% are experiencing some sort of professional distress, professional burnout, emotional exhaustion, cynicism, PTSD, moral injury, and those forms of professional distress increase rates of medical error substantially, patient experience suffers, patient costs increase for the individuals and for the organizations. Those professionals that are under distress are more likely to abuse substances, they're more likely to have relationship problems, they're more likely to have lower productivity, they're more likely to leave the field altogether, they're more likely to think about suicide, and they're more likely to commit suicide. It's a bad situation, and it's a wonderful opportunity for us to, one step at a time, improve our work environments so that we are better able to care for people in the best possible way. You cannot give what you do not have, and Listen, Sort, Empower is one of many steps that we can take to be able to give more to our patients. Muhammad Ali taught us that it's not the mountains ahead to climb that wear you down. It's the pebble in your shoe. And so Listen, Sort, Empower is about identifying pebbles and having the people doing the real work closest to the patient identify those frustrations, the processes that are broken, the systems that don't communicate, and we enable them to identify those pebbles, frustrations, broken systems, absent processes by first listening, and then with the list of opportunities to improve the lives of professionals and the outcomes for patients, we sort based on impact and feasibility. And instead of doing this for the staff or to the staff, we do it with the healthcare professionals. So we empower them as professionals to share this responsibility of improving our work life to improve the well-being of patients. I've had experience in this work for close to 2 decades. The first 217 clinical units that we engaged with Listen, Sort, Empower, we published the results, and satisfaction, teamwork, and burnout all went in the right direction. Since we published this, we've had experience in multiple different kinds of organizations, from community hospitals, critical access hospitals, academic medical centers, private practice groups. We've worked with colleagues over in Europe, in the national health system, in the United Kingdom and Scandinavia. This works. It just takes time and effort of leaders. Other folks have used a process that's almost identical. Dr. Mark Linzer published this work in a cluster randomized trial and basically showed the same results with a almost 22% reduction in burnout compared to the control group of 7%. So different investigators, different organizations, this listen, sort, empower is validated, it's evidence-based, and it makes a difference in the lives of healthcare professionals and their patients. They're basically 3 steps. Listen to the team to discover local opportunities for improvement. You sort those LOFIs, the local opportunities for improvement, and prioritize them. Start with one and then work on that, move to the next, empower the team to make those changes. And then if you want to call it the 4th step, it's repeating. This is not a project. It's not an initiative. It's a way of engaging staff, colleagues, friends, in order to continuously improve our work environment, which is the root cause of the vast majority of professional burnout causes. Our work environment, things that don't work, pebbles and shoes, broken processes. And so the first piece of this, listen, we have detailed instructions and questions. The essence of it is create a psychologically safe environment for colleagues to share what works well, what does a good day look like in your organization, in that work unit, and what gets in the way of that best possible day in your work area. And talk about those frustrations, things that don't work well. Don't try to solve them. Don't be defensive. Just collate them and, as a scribe, list them. And then discuss them a little bit, only to understand, not to solve. Record them as a scribe. And that's the essence of a listen session. You'll hear a lot of opportunities for improvement. Don't get down about that. But make sure the group understands that you are committed to addressing them one local opportunity for improvement at a time. The second piece is sorting, and there are a number of different variables you sort on. Is this with the local control for the remedy, or is it a shared control with another work unit from the, like emergency room, triaging patients to the floor? So is it shared, or is it someone else's responsibility, like higher up in your organization? That's one way to sort these, so you understand what you can do by yourselves, with someone else, or what you need to communicate to another part of the organization. And then the sorting includes also looking at the impact. How important, how much difference would this make if we actually succeeded in addressing this local opportunity for improvement? And then you cross that with the feasibility. If it would dramatically improve the life of the healthcare professionals in the work unit, but you don't have the resources to do it, or it's a mountain too tall to climb right now, then it wouldn't be one you'd start with in the next month or 2. But maybe next year it would be. So you look at something that has high impact as possible and that's feasible, and then you triage and sort that way. Another way to say this is it within your sphere of control as a leader, a team, a work unit? Or is it something you could influence but not control? Or is it just something you're concerned about and it's out of your sphere of control? Then we get to the empower, where we've sorted, we find something that's reasonably high impact, that's feasible to do within your sphere of control, and then you empower part of your work area to address the local opportunity for improvement. It could be the work unit. It could be a team in the work unit. It could be the leader of the work unit, or it could be an individual or 2 within the work area. But one way or another, it's within the sphere of control of that local region. And you don't need the dean, or you don't need the CEO, you don't need the CMO. It's something you can do, and then you're ready to empower someone in your local area to start working on it. Paul Batalden taught us that every system is perfectly designed to get the results that it gets. And if you look at American healthcare organizations today, our systems are designed to burn out professionals. Some of that's a leadership system. Some of it is the processes and workflow. Some of it is our compensation models. Whatever it is, the systems that we have in place are perfectly designed to take pre-med students and pre-nursing students who have above average mental health and squeeze out that vitality so that half of them are experiencing professional burnout within a handful of years after they get into the profession. So this is about systems issues. So let me give you a few examples of how this listen, sort, empower flips numbers. When we first started doing this at Mayo Clinic 15 years ago, when I was head of leadership and organization development, there were two departments across the whole organization of about 5,000 medical physicians and scientists in an organization of 65,000 staff, 23 hospitals. The two departments across this large organization that had the highest rates of burnout were hematology and urology. Martha Lacey chaired hematology, and what they did with Listen, Sort, Empower was find out that everybody was frustrated, particularly the nurses, but the whole care team, with all the phone calls they were getting from patients and family members after they left the Mayo Clinic with their instructions, because that process was defective, and one phone call at a time, they put together all the information that patients should have and their family should have so that they wouldn't be frustrated, the patients and families, and the staff wouldn't, with telephone calls and communications, because the communication wasn't high quality. Within 18 months, this work on phone calls from poor communication and other listen, sort, empower work flipped the numbers so that hematology then had among the lowest rates of burnout among all the departments. Similar thing happened with urology. Dr. Brad Leibovitz chaired that department among the highest rates of burnout at Mayo Clinic. A year and a half later, among the lowest rates of burnout. His process with Listen, Sort, Empower was basically saying, here are the tasks we have before us. These are the outcomes that we need to be a part of our integrated practice. Let's figure it out together. Instead of coming in and saying, I know the answers, let me fix it and get out of my way, he did it not to them or for them, but Dr. Leibovitz did it with them. And they co-created and co-designed through Listen, Sort, Empower a better way to lead department and take care of patients. And again, at 18 months later, we measure burnout and professional distress annually. A year and a half later, they had dramatically improved, and now we're in the top 25 percentile for lowest rates of professional burnout. Another one in another organization was very simple. Sometimes these are big pebbles and sometimes it's little. This is a group of nurses. They were very frustrated that their nurse manager, who they adored and respected, was typing emails every night and typing emails every Saturday and every Sunday, and they felt that they had to respond to those emails. This was a pebble in their shoes, and it came out in the listen session, and the nurse manager was a little bit surprised and frustrated and embarrassed, and she stopped doing the emails on nights and weekends that day, and only during work hours, standard 8 to 5 work hours. And that was an easy pebble to remove. It didn't need a black belt, Six Sigma effort. Some are bigger. So Dr. Laura Fedor and Nurse Evans at the McKay Hospital at Intermountain Healthcare looked at the rounding time in their intensive care unit. You can see in the graph, it was about a little over 7 hours to complete rounds in the ICU. Everybody was frustrated, patients, families, staff. And then 8 months later, they, after just listening to what was wrong, and through the eyes of all members of the staff, from respiratory therapists to the nurses to the doctors to the managers, they removed those pebbles one at a time, and they got down to about an hour and a half rounding time for the same ICU at this hospital. And that took a little more time. It didn't take a rocket scientist. It just took time to listen and sort and empower. At Mayo, this is Dr. Thor Sant, cardiac surgeon. He's had a cardiac surgery at the time. His surgeons were in his cardiovascular surgery group were frustrated with the interruptions in the operating room. So they just listened. What is it? And observed. What is it that's interrupting? And long story short, they dramatically introduced the number of interruptions. That in turn substantially decreased the time that patients were under anesthesia, the time for the case. It decreased medical errors that they published these results in the journal Surgery. And at the end of the day, the morale was up and their productivity was up, which was not the driver for this. And it was just a matter of taking time to look at these bad processes that hurt good people every day. So if you look at the best places to work, great places to work, Michael Bush is the president and CEO of that. I met him a couple of years ago. This is about getting to be a great place to work. One work unit, one department, one division, one section at a time. Michael Bush summarized 3 decades of research with one sentence. He says, the characteristic of these organizations that are the best places to work is the root of the tree is trust. And so this work to listen, sort, and empower, and fix and address issues together is about building trust. Another way to look at it is Robert Reich, former labor secretary, with his pronoun test. He judges the mortality, or the vitality of organizations and work units by listening to the staff talk about their organization. If they use the pronouns they and them and theirs, they are much worse off than if the staff talks about their organization, their leaders, their work unit, their department, with the pronouns we and us and ours. And so listen, sort, empower, because it's collective work, it's working together as a team, gets us from the bad pronouns of they and them to the aspirational pronouns that we all want to use about our workplace of we and us and ours. And so let me summarize this with General Schwarzkopf's observation that leadership is a potent combination of strategy and character. But if you must be without one, be without the strategy. This is about character. This is about leaders enabling staff to co-create, co-design the best possible workplace by listening, by really listening, sorting, and then empowering the staff to together make for the best possible future for that group of people, for the mission of the organization to take care of patients and families and communities. I see good things in your future. Listen, Sort, Empower, I hope will be part of your good story with this work. Thank you very much.